programs. There is, grants that are available. You just gotta, it's a tough, like I said, it's a tough journey. It's tough to figure all of this out. So you really need an expert to really help you with it. Alan?
Just something that many people are not aware of. If you have a long-term care insurance policy, many of them, but not all, will include a provision that they will pay for home modifications up to X number of dollars to keep so you can stay in the home. It's a lot cheaper for them if you stay in the home as opposed to they're having to pay for another community for you to move to. So if you've got long-term care insurance, be sure and check with whoever your insurance carrier is to see what your policy covers.
Alan, I'm so glad you brought that out because there's so much that we can cover today. But I want to expand on what he said. Real quick, does anybody know if you've got a long-term care policy? Okay. All right, let me just tell you something. You really need to know that policy inside and out, because don't assume because you have one and she has one that they're the same. You may have it with one company, you may have it with another. Even if you have it with the same company, doesn't mean it's the same. There are very many creative ways for long-term care to be written, but 100% of the people that I've helped that have long-term care end up going into a better facility. Just like, because it does supplement it, okay? But to what Alan's talking about, there are long-term care policies that in addition to ramps, some of them have in-home care. So it means you can bring somebody, in the home, a company, to take care of whomever so they can stay in their home longer. But it's got specifics. It may be a set amount a day. It could be a set amount a month. It could be specific. So those that have long-term care policies, something else I suggest is you review it with your agent or someone in that company every year. Why? Laws change. Why? Because your policy could be sold to somebody else. And you need to know anything that changes with that policy. You need to know that policy. Just like life insurance. Now we're talking about things like that. There's another unfortunate kept secret. If you do not have a will, I'm going to tell you, you need to get it in place by the end of this month. No one should not have a will. You know what? You got things that you want directed or whatever, the way you want them done. There's things that we don't like to do sometimes. Pardon me. Okay. There are things that we don't like to do sometimes. Having a will written was the toughest thing I had to do. But I have to tell you what, once my husband passed away, guess what? I was in there the very next week. Because we want things done the way we want them done. If you don't have it documented, then you don't know what's going to happen. Yes, sir.
I just finished an executorship. I had 3 executorships that I ran for the last about 4 or 5 years. And without a will, you can end up with family squabbles, children, brothers, nephews. I have a brother-in-law that is estranged from the family now because of the problems in the will. If there's money involved, greed raises its ugly green head and in many cases takes over and changes people. The other thing is, in the state of Virginia, if you don't have a will, the laws are real strange and will do things to you that you don't want done. And nobody likes to think about it. Well, nobody likes to think about dying. But I'll tell you, nobody gets off this planet alive. It's eventual. Sooner or later, it's going to happen to everyone. I have my own obituary written just because I wanted to say what I wanted to say, and not what my loving family may want in there. I'm sure they're gonna embellish it. They're gonna sure they're embellish it or mention the fact of the chicken thief or something like that. But it's very, very important. The other thing is, in a will, you need an executor, and it should be somebody younger than you. It should be a child. If it's a brother or sister, they may pass before you do, and you need to talk with that person to say, I want you to be executor. Here's my bank account. Here's where I hid that money that I stole, from my bookie years ago. Here's where my life insurance policies are and things like that. And it's so very important.
It's huge.
And nobody wants to think about it.
It's huge. I'm going to tell you, that's another, what he said is so true. What happens is this, a lot of people think that the executor needs to be a child. Well, if you don't trust your son Johnny,
Do it.
guess what? Don't do it. Really, don't do it. Just because you think you have to, because he's your son, don't do it. I promise you, it'll be the worst thing you ever did. So, I just want to give you as much information as I can in a short period of time. Yes?
Joan, one thing in addition to the will, probably while you're alive, more important is to do a broad general power of attorney.
Correct.
If you ever become incapacitated for any length of time, everything you have, if it's in a single name, will be tied up.
Yes, it
And
will.
the family won't be able to access funds to take care
Yes.
of you. And that's a very important document.
Tattoo DNR on your forehead.
That's exactly right. So, don't forget those things. I'm going to switch over to assisted living. A lot of people think that they, like I said, they've got to go from home to nursing home. Not. You don't have to do that in today's world. You can actually go to assisted living. What is assisted living? Well, I'm going to tell you, some of the buildings today, they look like cruise ships on the ground. Just letting you know. I have never seen people have as much fun as they do. Just letting you know. We have assisted living means you might need some type of assistance with bathing or dressing or transferring or medication management. It doesn't mean someone doing it for you. It might be supervision of some of those things. You may have a hard time managing your meds. So if that's the only thing, you can go to assisted living for that. Now, they are all so different. They all have their special gifts. Now, the journey to find it is really tough. I'm going to tell you honestly why I'm saying that. They will do everything in their power to tell you what you want to hear. I don't mean that negatively. It's a fact. I'm just letting you know. It's a fact. We have some wonderful communities, just letting you know. Wonderful gifts. But how do you figure out, what's the best thing for you? Let's go back to what I said in the beginning. The wants, the needs, and the financial situation. Because assisted living, it can range so hugely. It's so huge. And all of these places have different ways of charging. Now, you're gonna definitely have a base rent. Okay? That's right. You're gonna have a monthly rent for your apartment. That apartment could be a studio, meaning you walk right on into a room, a big room like this. It's got a bedroom, a dresser, a chair, TV. There's lots of activities going on outside in the community. Most of them have, oh my goodness, you could be busy 24/7 with activities. They want you to be independent. They want to keep you active. A lot of them have got exercise equipment. Some of them actually have therapy either in-house or they have companies that come in and provide therapy for people. These communities also permit hospice to come in. So really, you can basically stay in assisted living till the end of life. That is a lot more economical than a nursing home if you can get your foot into an assisted living. So, what happens is people say, well, tell me, my mother needs, somebody watching her, keeping their eyes on her every 10 minutes. Well, you gotta figure out, that's part of the needs. If mom needs someone to check on her every 10 minutes, then assisted living probably is not the right place. Why? Because by law, in the state of Virginia, they really only have to check on you every couple hours. Now, that's not the way it is in every community, but by law, they've got to do it every 2 hours. Depending on what the needs of the resident is, they may do it more often. But here again, there's a ratio. So don't assume that the ratio of resident and care is always the same in every community. It's really based on the need of the residents. So some residents have equations. It's another best kept secret. Some of them have you go in and they ask lots of really good questions. You know why? They want to make darn sure that they're staffed correctly to handle whatever the needs of mom is. So if they add the needs of mom and the needs of this resident and the needs of this resident, they may need one person that takes care of just 2 people. That's another best kept secret. That's probably a community you want to go to. You know why? If you've got 10 people that have a high level of need of care and you've got one caregiver, 9 times out of 10, your mom is not going to get the care she needs. Just saying. So, but basically what happens is you have the rent, and then sometimes there are communities that charge a la carte, meaning based on whatever your care needs are. If you need help with bathing, you pay this much. If you need help with med management, that's an additional charge. Some people are a la carte, so you only pay for the care that you need. Some of them, they charge, there's different levels of care. They're all different. So you gotta find out, do some reviews. You know what? Ask your neighbor. But don't assume that they're bad just because you had somebody that stayed there 7 years ago, that they're still bad today. Some of them probably are. But, don't make that assumption. So how are you going to make the best decisions? You know what? Maybe what you do is say, give me a referral. But 10 times out of 10, they're going to give you a referral that's successful. You may want to say, tell me how many people that you've tried to help that really do come here. You'll get that deer in headlight look. You may say, tell me what your response time is when mom pulls the cord and needs help. They're supposed to keep those records. Ask to look at those records. You have the right to look at the record of any of your loved ones in assisted living. If they tell you you can't look at it, call me.